Type 2 diabetes is probably the most common disease that we see as a whole. It's, as you know, quite common in the American population. So we see kind of a broad spectrum of folks, people that were just newly diagnosed, perhaps never knowing they had any symptoms of it before, versus people who've had it for many years. We see both type 1 and type 2 diabetes, as well as people with prediabetes or special circumstances like diabetes after transplantation or after weight loss surgery. Typically, as specialists, they've already been diagnosed before they see us. And often their primary care physicians have tried to manage their diabetes, but for whatever reason, they need some expert help. In fact, most people with diabetes never end up seeing an endocrinologist. Well, it depends on how comfortable the referring physicians or other healthcare providers are with diabetes. Some people are very comfortable because they see it so much. We tend to see more people here that are on perhaps newer anti-diabetes agents. Are they candidates for these agents? We definitely see a large number of people who require insulin therapy. A lot of our referring providers are not as comfortable managing insulin therapy, insulin pump patients, people who need sort of specialized, highly concentrated insulins, or people that have already acquired a lot of complications of diabetes and perhaps are a bit harder to manage than a lot of the folks that are out in the general population. Diabetes is more than one thing. So type 1 and type 2 diabetes are actually different, have different underlying causes. And there's a lot more treatment and understanding these days than there ever were before. In the last 15 to 20 years, multiple new classes of medications have actually been developed. Much more if you go back and just look historically, we had one or two classes of pills and a couple of different types of insulins, and now we have 7 or 8 classes of medications for type 2 diabetes. We have a whole range of insulin therapies. So there's been an explosion of understanding as well as treatment options. That's probably what we do more than anything else. People also see us when they feel like they're overwhelmed with their choices, and we have a little bit more time than a lot of primary care providers do to actually sit down and run through all of the options. So it's very individual. We sit down with the patient, we run through a lot of the gamut, what they are sort of candidates for, what aren't they candidates for. There's a lot of crossing off the list by the time you get to us. And then finally working with someone, taking into account how long they've had diabetes, what other medications they are taking that might interfere with some of our medications, what other medical conditions they have. Do they have some kidney disease or heart disease? And then finally, a big piece of this is cost. How much are some of their co-payments on medications, because obviously we have these wonderful new treatment options, but they're also quite expensive. And we see people who have very good pharmaceutical coverage that they have to pay very little or nothing for even the most updated medications, and then we have people who have very high out-of-pocket costs. And that's actually one of our biggest obstacles, is how much does somebody pay? It's a very expensive disease, not just for medications, but for everything else that goes along with it. So actually, some of our most common insulins have actually been increasing in price. In fact, one of the insulins that has been around for quite some time has had an increase in price recently. So we're in a bit of a catch-22. One would think more competition would drive down prices, but as a biologic agent, it's actually a protein. People tend to, let's say, charge a little bit more. So in fact, it can be quite expensive to get insulins in general, and then specific insulins can be low cost. We have a whole list of low cost sort of locations. Now the oral agents have to come off patent, so we have more generic medications for pills. But obviously the ones that you see advertised most on television are going to be your branded products. And some of them are actually quite good and quite appropriate. You know, they don't cause weight gain, they have good control, but they come at a price. Sometimes we try to work with the insurance company. That usually is pretty time intensive and paperwork intensive. But a lot of times we just work with what we have. So we still have patients that we see that are uninsured that require insulin therapy. And so there is an option, which is Walmart actually has a reasonably priced older insulin that you can get, as well as a reasonably priced glucometer to check blood sugars, because actually that's quite an expensive piece of the puzzle too. And so we just work with them to try and find the best possible combination of things. It can be a challenge.